Hello all, I'm Dr. Walter from SNS College of Physiotherapy. So today we are going to see a new video based on Myasthenia Gravis. This condition, it is the most important condition for the clinical knowledge and also for the examination purpose. So we are going to see what is Myasthenia Gravis, the unmasking, the definition, the etiology, the pathophysiology, the symptoms and signs, and all these things which we are going to see in this video. Hope this video will be helpful for the learning and the theoretical examination purpose. So the definition and the epidemiology, going for the definition, it is autoimmune disorder which causes the fluctuating muscle weakness which impacts voluntary muscles worsens with activity. So autoimmune disorder plays a vital role. So autoimmune disorder, we have studied n number of studies based on autoimmune disorder. Our own cells will fight against our cells, healthy cells, and this is called autoimmune disorder. And these types of cells and these types of disorders are really pathetic, and it is also a fatal effect in the human body. The prevalence study which going for it affects 15 to 20 per 1 lakh globally. Around the world, 15 to 20 people will be affecting based on this. And onset, which can occur at any stage, at any age, and peaking in higher in young women than men. So next one, it is going for the older men. So these two terms, which is most important for the onset. Now, the immune assault, that is the pathophysiology for the myasthenia gravis. So, how this is going for the pathophysiology? The antibodies target AChR, that is the acetylcholine receptors, which impairs nerve to muscle signal transmission. Usually, a nerve will be supplying to the muscle, and from that, the motor and the sensory signals will be acting around. So, what is happening in the myasthenia gravis in the pathophysiology? The nerves will get a repair, and their transmission from nerve to muscle will be getting for the damage. And thymus gland, often or abnormal, playing a key role. Thymic hyperplasia is common. The thymus glands also plays roles in the pathophysiology of the myasthenia gravis. And next one is the genetic factors, which will be going for HLA test. And HLA test can be classified, and based on the specific type of HLA, it will affect the autoimmune disorder, and this will induce the myasthenia gravis. Now, going for the signs and symptoms, first one is ocular weakness, that is the drooping of the eyelids is common, the initial symptom, and the double vision, diplopia. Facial and bulbar will be going for the dysphagia, which we cannot able to swallow easily. Dysarthria, speech difficulty, we cannot able to speak. The limb weakness going for the muscles paralysis, and fatigue will be common for all the myasthenia gravis patient. And going for the respiratory crisis, severe weakness can lead to breathing difficulty, and urgent medical requirement is needed. The diaphragm muscle will be going for the muscle weakness, and this is most important muscle which induces the inspiration and the expiration. And if this muscle is going for the weakness, it will cause some defects like breathing difficulty, and will lead to the fatal effect. Going for the diagnosis, initial clinical assessment, going for the history collection and the neurological examination, the antibody testing, the AChR test, and the MUSK test, this muscle specific kinase test, electrodiagnostic going for the single fiber electromyography test, and the imaging going for the chest CT scan, and differential diagnosis is most important. Going for the therapeutic arsenal, there is a management strategies. Managing a condition is most important. Symptomatic and the immunosuppression drugs, rapid response drugs, thymectomy. All these things will be helpful for the management of the myasthenia gravis. The steroids, azithromycin, mycophenolate, the IVG plasmapheresis, and the surgical removal of the thymus, which are helpful in the management of the myasthenia gravis. Complications and the prognosis. So myasthenia gravis, it increases the severity of the respiratory muscle weakness. Ventilator support is most important, and the cholinergic crisis, the overdose of ACHR, which will go for MG weakness. And the prognosis generally good with treatment, but most patient will go for fatal effects. Side effects will cause bone density less and the infections in the bone, and all these things will be happening in the side effects. So advancements for the recent days, early diagnosis is a good term, and the personalized care, the imaging therapies, and these are targeted biological inhibitors, which will help the myasthenia gravis patients recover at ease. The ongoing research is going at a faster level to find a proper cure and a complete cure for the myasthenia gravis. Hope this video will be helpful for the clinical purpose and the knowledgeable gaining purpose. We'll meet the next video with another slide. Thank you.